diagnosis for this, okay, elderly woman who's having the classic triad, okay, of a gait. She's having cognitive, she's having cognitive dysfunction as well as urinary incontinence. They're talking about a normal pressure hydrocephalus. The targeted demographic for this particular syndrome is elderly patients, so you can automatically like connect that with this case. So yeah, like I mentioned, it has a triad of that, urinary incontinence, okay, cognitive dysfunction, as well as your gait. In this case, I've mentioned broad-based shuffling gait. Now, shuffling gait is usually what we use that to describe a case of Parkinson's. In the STEP exam, they will most likely mention magnetic gait, which is kind of seen only in normal pressure hydrocephalus. Magnetic gait, either they'll mention the word, otherwise they'll mention if like the patient kind of stands and they feel like they're stuck to the ground, they're not able to move. On the other hand, shuffling gait, as you know, they take very small steps very fast. That's why it's called shuffling. Okay, so we'll reserve that mostly for Parkinson's. Magnetic gait seen in the case of normal pressure hydrocephalus. Okay, so accumulation of amyloid plaques and neurofibrillary tangles in the cerebral cortex or tau tangles. Here they're referring to Alzheimer's disease. In this case, there's absolutely no mention of dementia or any sort of memory loss. You can very easily rule option A out. Option D, dilation of the ventricular system. Yes, like I mentioned, the diagnosis is a normal pressure hydrocephalus. Okay, so it is because of the dilation of the ventricular system. So the thing to note in this case is, actually, no, that's not required. Just know that it's option B. Okay, the next one is degeneration of the substantia nigra pars compacta. Here they're talking about, substantia nigra pars compacta as a portion of the basal ganglia. So they're talking about Parkinson's disease. I already mentioned the shuffling gait and the magnetic gait difference over here. In addition to that, here they say increased muscle tone in her limbs. Here it's described as paratonia in the case of normal pressure hydrocephalus, whereas in the case of Parkinson's, it's called cogwheel rigidity. It's different in that way. It's another differentiating point. And then another thing is in Parkinson's, you will see bradykinesia or akinesia. So that's another very important thing. Okay, meaning they will have very, very slow reflexes, unlike in this patient where there's exaggerated DTRs. Okay. Option D is accumulation of Lewy bodies in cortical cells. This they're talking about Lewy body dementia, and they will kind of specify the most important feature of Lewy body dementia in the exam if you were to get this question, and wherein they'll mention visual hallucinations. That's very specific for this. And in addition to that, they will also have not just cognitive decline. As you can see in this patient, she's distracted and all of that. Usually you will have some sort of cognitive decline in this case, but in the case of Lewy body, it will fluctuate between a state of cognitive decline and alertness. So it's not like their cognitive levels are progressively getting worse. They will be, kind of confused for a second or for a certain amount of time, and automatically they switch to being alert. So it'll just keep fluctuating between the two. That's just one of the features that they will explain if they're expecting you to go with Lewy body as the answer. Okay. And caudate head atrophy. This they're talking about Huntington's disease. Nothing in this case really points towards the diagnosis of that. They would definitely mention chorioathetosis, as you know, is like purposeless jerky movements, or they will mention some sort of psychological issue like psychosis or depression or even dementia and later stages of Huntington's. They'll definitely mention that if they're talking about Huntington's.
Thanks for watching. Please give a thumbs up and subscribe for more.